Ohio. As he said, our youth are constantly being bombarded with new tobacco products. A good example is here in Columbus. RJ Reynolds is getting ready to test market a new product here. It's supposed to start January 1st, but I'm not sorry to say that they're running a little late, it seems, but they have a new line of dissolvable tobacco products called sticks, strips, and orbs. The orbs are like mint. It's finely ground tobacco. It's mint flavored. It dissolves in your mouth. A stick is kind of like a toothpick. You put it in your mouth, it dissolves. The strips are like breath strips that you put on your tongue and it dissolves. All are dangerous to our youth because they're perfect for undetected by teachers or parents. Point is, the tobacco industry doesn't stop, but unfortunately we have. The implications this has for Ohio citizens, both in lives lost and in healthcare costs, are serious. As with the example I gave at the beginning of this press conference, there are consequences to individuals' health and to the state budget and taxpayers. I'd like to share some, some of the costs involved to the state of Ohio. $7 billion, that's how much smoking costs the state of Ohio annually. What does it mean to each of our taxpayers? A lot of times people think that smoking is someone else's problem if they don't smoke. The Ohio households pay in state and federal taxes annually due to smoking $636. That's every year, each Ohio household. In healthcare costs related to tobacco use, Ohio pays $4 billion annually. Of that, $1.4 billion is the portion paid by the state Medicaid program. If we save a child from smoking, we save $16,000 a year for every child we save. We have a lot of other priorities here in the state of Ohio that we would like to fund, important things. One is education. We hear over and over we can't afford education. If we got rid of the smoking problem, we would have $3,803 extra per student in the state of Ohio to spend on education. That's a lot of money that we're spending on that, so it's everyone's problem. Our tobacco prevention and control funding went from a C to an F. When your child brings home a C on the report card, you know it's likely they need a little help. You might have to do a little homework. But when they go and bring home an F, you know it's time for serious action. And that's what we need in the state of Ohio. That's why a coalition of 62 businesses and organizations, the Investing in Tobacco for Youth Coalition, has been working to equalize the tax on the non-cigarette forms of tobacco. That's the cigars, little cigars, smokeless, hookah, and use the resulting funds to fund tobacco prevention and cessation through the Ohio Department of Health. It just makes sense to use tobacco-related money on tobacco. By keeping our smoke-free air law strong and warding off all attempts to weaken it, by raising our tobacco taxes and using the money to fund things like cessation and our tobacco prevention programs, we can make Ohio a straight-A student, and it will save Ohio lives and save Ohio money. Now, I'd be glad to take any questions if anyone has any.
I apologize if we got it late, so can I ask your name first of all?
Yeah, Shelley Kaiser, S-A-G-L-L-Y-K-I-S-E-R.
Shelley, I certainly understand the concept that the state's not spending as much money as you would like them to spend, but I wonder if you could flesh out for me how you think the state has failed. When I think of failure, I think that they're not spending any money, maybe, but can you explain to me how they're failing?
How that is, the grades are based is the CDC sets a specific amount of money that each state should be spending based on their population, based on things like their media market, things like that. And so this is based on comparing how much they're spending based on what the CDC says this state should be spending.
So if they spend less, they just got no funding whatsoever, would it be zero, or would it still be that?
Well, it's based on how percentage of that they are doing. So there are falls within the F percentage. We are spending so little. We're spending, I think our amount total is $6 million when we're supposed to be spending $145 million.
6 out of 6 million, I should be 145. And have you seen results from that? Have you seen an impact? Can you point to anything to show us and say, hey, here's where you're noticing that?
To give you an example of how we know those things work, first of all, we have tons of, and this is what the CDC bases their findings on, that there are tons of states that have spent adequate amounts of money on prevention and cessation and done all of these things. And it does work. The results have shown that. That's why they make their recommendations about what to do. To give you one example, a recent study, I think it came out this summer, In the state of California, found there was 50 to 1 return on investment in tobacco prevention and spending and healthcare dollars. So there's proven that you do get a financial return on your investment, and you do see the rates lower. The states that have done these things, for instance, New York City has incredibly low youth smoking rates, and they have done these all things in combination incredibly, and their youth smoking rates are way lower than us. It's a little confusing. Yeah. Cessation rates based on a number of things. One, whether you have Medicaid should cover nicotine replacement therapy and medications and counseling. Ours covers nicotine replacement therapy and medications, but with a copay. And when you're on Medicaid, you usually don't have money for a copay, so that's a barrier. It doesn't cover any kind of counseling whatsoever. Our state healthcare coverage covers most of the state healthcare plans do not cover cessation. Though it says some of them do, most do not. Also, there's no mandate that health insurance covers health insurers cover cessation treatments. So that's why I think that
What would you say to somebody who wants to quit but isn't quite able to do it on their own?
The most effective way that we found is a combination of using nicotine replacement therapy and with counseling together. But the most important thing to do is to not quit trying to quit. It usually takes multiple quit attempts. So to keep trying to quit and to use that combination is usually the best one. But never quit trying to quit.
Do you have any examples of how the indoor smoking ban has affected some of the other areas? I know that was kind of used as one of the reasons for taking some of that money from the tobacco prevention and control spending, was that the state does have this indoor smoking ban, and that's having an effect on smoking levels.
I've heard that said by our lawmakers, yeah, that solved the problem. A law by itself like that will certainly not bring the smoking rates down by itself, and we've proven that has not been in effect. In fact, our smoking rates have stalled. Our smoking rates have stayed the same. In fact, the nation just recently, the smoking rates for the first time went below 20%. Ohio stayed the same. So, is that one of the things that will help? Definitely. We saw an increase in people calling to get help and stop quitting. Is it the only thing? No. The CDC, as I said, the best practices when they studied which states are most successful and have seen the rates come down, it's the combination of all these things working together that bring the rates down most successfully. It's none of these things by themselves.
Do you expect to see another attack on trying to weaken that by lawmakers this council?
They have said it will, so we hope not. We hope they don't try to usurp the will of the voters, but they have threatened that.
Shelley, given where the economy is, do you see the funding improving in the next few years?
I hope so. As you can see, when you don't improve it, things get worse. I mean, we have to have lawmakers who think of prevention. If you don't think of prevention, then your costs are exponentially worse. If you have thought of prevention, you know, you're kind of gonna make things better in the long run. It's sometimes hard for our lawmakers to think long term because they're term limited, so they're thinking short term. But prevention, you know, is worth a pound of cure. It's definitely true. You save tons in the long run by making a short-term investment. It's the same for any type of healthcare prevention.